All right, so you're about to go on to Medicare. This is an exciting time, but I have found that a lot of people are nervous about it as well. You have a lot of things coming at you, advertisements and commercials. You're probably getting some phone calls. So let's talk about what you need to do to prepare for going on to Medicare. I'm Lindsay. I am a licensed agent and I help people who are transitioning into Medicare so that you have a trusted advisor as you're going through this process. So the first thing to do is to determine when you're going to go on to Medicare. You have a couple options. One is, of course, you can go on to Medicare when you turn 65. This is the most common. So you have a 3-month window in the months prior to your birth month to sign up so that your Medicare would start the first day of your birth month. You also have 3 months after your birth month to sign up during that time as well to avoid that late enrollment penalty. Now, there are ways to avoid that late enrollment penalty. If you're planning on staying on your employer group plan, and it is considered credible coverage, you can stay on that and you will not have that late enrollment penalty. But let me tell you, right now there are over 700,000 people in America paying a late enrollment penalty. So this means that they either didn't know they were supposed to sign up yet, or they just didn't get around to it. I don't want you to be in that situation. So definitely know which way you're gonna go. Are you going to go on to Medicare when you turn 65, or are you gonna wait and stay on your employer plan? You can also choose to continue working, but go off of your employer plan and onto a Medicare plan. Sometimes the health insurance that your employer offers may be high deductible, or maybe it's expensive. So you can choose at that time to go ahead and go on to Medicare, and that is a very common choice as well. We can have that conversation later. The next thing that you're going to want to do is to have a conversation with a licensed agent. So whether that is someone in your community or maybe someone on the phone that you know that if you have troubles with your applications, with your plan in the future, that you're going to be able to get a hold of that person again. Sometimes people get on the phone with these call centers and the person on the line might be really helpful, but if you have a problem months down the line with your plan or have questions, you're probably not going to be able to reach that person again. Having a licensed agent that you'll be able to reach at any time during business hours who can assist you with service requests like finding in-network doctors or maybe billing errors that maybe the hospital or the clinics have submitted, and you just need some assistance with how to proceed with those things. There are great agents that provide this kind of assistance, and that's what you deserve. So have a conversation with an agent, determine who you want to work with. This should also be an agent who has multiple options for you, not one that only has one company that they write business with. You want to be able to see your options amongst several companies so that you know that you are making a good decision for your healthcare needs. Finally, you're going to give that agent your list of doctors and prescriptions and pharmacy. Those things matter when choosing a plan. And so have that information readily available for that conversation or in the follow-up conversations. Once you have decided which route you're going to go, what plans you're going to sign up for, then the enrollment is the easiest part. Many times that can be done on the phone through text message signatures or email signatures. Some companies even allow us to do it by a voice recording. So this is a very easy part of the whole process because by now you have been well informed, you're working with an agent that you trust, and you're ready to sign up. So if you have any questions, we would love to talk with you. Have a good